All right, what's up, guys? So today we're going to be learning about metabolic acidosis, metabolic alkalosis, respiratory acidosis and alkalosis, being able to tell the fundamental differences between those four, and then we're going to get into some compensations. So your normal pH is 7.35 to 7.45. Anything higher, you're going to be going into alkalosis. Anything higher than 7.45, anything lower than 7.35, you will be going into acidosis. Your normal bicarbonate is 22 to 28. Some nursing schools will say 22 to 26, so just make sure to check in with your nursing school. Regardless, they're very close in range. And then your CO2 is 35 to 45. However, just for being able to tell the differences between metabolic and respiratory issues, forget about the CO2. We will worry about the CO2 once we get into compensations. Just to tell the differences between these four, we only need these two. So, all metabolic issues, your pH and your bicarbonate will be going in the same direction. All respiratory issues, your pH and your bicarbonate will be going in opposite directions. For example, metabolic acidosis. This already means pH is going to be going down because it's acidosis. But it's metabolic, which means bicarb will be going down as well. Because metabolic issues, pH and bicarb go in the same direction. Metabolic alkalosis. If you're in alkalosis, pH is high, which means bicarb is going to follow as well. Same direction, guys. Respiratory acidosis, you're in acidosis. pH is low, which means bicarbonate will be high because they're in opposite directions. Respiratory alkalosis, pH is elevated because you're in alkalosis. Bicarb is low because they're in opposite directions. Let's do some examples. pH 7.24. Well, your normal pH is 7.35 to 7.45. That's definitely on the lower side. So we already know this is going to go down. Your bicarbonate is 45. It's definitely higher than 28. Look, guys, they're going in opposite directions. So we already know it's a respiratory issue. pH is low. So this is respiratory acidosis. And guys, feel free to pause the video so you guys can do some practice on your own as well. And then check back in to see if you guys got it right. If not, we learn from our mistakes, right? pH 7.48. That's definitely higher than 7.45. So it's elevated. We already know we're in alkalosis, right? Bicarb 30, definitely higher than 28. Same direction. We know it's a metabolic issue. And we're in alkalosis. So we're in metabolic alkalosis. All right, pH is 7.31, definitely lower than 7.35. Bicarb is 20. Normal bicarb is 22 to 28. So guys, again, arrow is going in the same direction. That means we're in metabolic. And pH is definitely low, which means we have metabolic acidosis. So, you guys see how we do not even need the CO2. Forget about the CO2. If you guys just want to know what you guys have, just focus on pH and bicarbonate. So, but once we get into compensation, that's when we're going to start bringing the pH, or the CO2, into consideration. So uncompensated, your pH is going to be out of range, and then your bicarb and your CO2 are going to be in range. A little quick tangent so you guys can understand a little bit more, so we can all understand, because it can be a little confusing when you start dealing with this. Guys, when we say compensation, your lungs compensate for your kidneys, and your kidneys compensate for your lungs. And what I mean by that is your lungs, you breathe in oxygen, you release CO2. Excessive CO2 will cause your body to become acidic. So your lungs will start releasing more bicarbonate to be able to compensate. This is compensation. Likewise, if your kidneys aren't producing enough bicarb, or they're producing too much bicarb, or you're not excreting the bicarb, anything of that, your lungs are going to compensate with either hyperventilating to blow off more CO2 or hypoventilating so you can hold on to that CO2 so you guys can balance that pH out. That's how the body works. So that's what it means when we talk about compensation. So taking that into consideration, when you have a respiratory issue, this can get a little confusing, but it's a lot easier once we get into it. So if we have respiratory issues, we're going to have to focus on the bicarbonate because, like I said, if your lungs are not doing well, your kidneys, which release bicarbonate, are going to start compensating. Likewise, if you have a metabolic issue, your CO2 from your lungs are going to start compensating. What I mean by that is if you have let's say you have metabolic acidosis, to be able to tell if it's uncompensated, partially, or fully compensated, you're going to have to look at the CO2 because the lungs compensate for metabolic issues. Likewise, if you have a respiratory issue, respiratory acidosis or alkalosis, you're going to have to look at the bicarb because your kidneys or your kidneys which release bicarb, better said, compensate when your lungs are failing, like you have like asthma, or you have COPD, or anything, or a pulmonary embolism. So they're always going to compensate. Metabolic issues, look at the CO2. That's when we take the CO2 into consideration. Respiratory issues, look at the bicarb. So that being said, uncompensated pHs, your pH is out of range, and your bicarb and your CO2 are in range. Think about it like your body's not recognizing like anything's off. It's still just chilling, it's relaxing. Partial compensation, pH is out of range. However, your bicarb and your CO2 are out of range. That was actually my fault. So, partial compensation, your pH is out of range, and your bicarb and your CO2, they become out of range as well. Because your body says, hey, something's wrong, we need to do something about it, and they start shifting the CO2 and the pH out of range. Yep, that was my fault. This is out of range for partial compensation. Full compensation, pH is finally back in range. That's why it's called full compensation. And your bicarb and your CO2 continue to be out of range. Take this into consideration because when you're in full compensation, your pH is back in normal range. However, you're still going to have to decide if it's acidosis or alkalosis. And this is when this comes in. 7.35 to 7.4 is technically acidosis. 7.4 to 7.45 we consider alkalosis. Okay? Because this is on the lower half of the spectrum, this is on the upper half. Let's do a few together, and then I encourage you to pause the video as stated so you guys can get some extra practice in. pH, 7.27. That's definitely acidosis. So we already have half the answer. Bicarb is definitely lower than 22. Both arrows are going down. This is already metabolic acidosis. But now we have to figure out what type of metabolic acidosis. Guys, this is a metabolic issue. So what compensates for your kidneys, for your bicarb, your lungs, and your CO2? So let's look at the CO2. This is going to give us our final answer. So CO2, first of all, pH is out of range. It has to be either of these two because full compensation, pH is in range. And this definitely is not between 7.35 and 7.45. So between these two, is the CO2 in range? No. Normal CO2 is 35 to 45. It falls in this category. pH is out of range, and CO2, because we have a metabolic issue, CO2 compensates, it's out of range. So we have metabolic acidosis, partial compensation. All right, let's do another one. pH is definitely high, right? Bicarb That's low. Arrows are going in different directions, with our pH in the higher range. So we have respiratory alkalosis. Respiratory alkalosis. So what do we look at for respiratory issues? Well, you have to think, what's going to compensate for respiratory issues? Your bicarb, right? Your kidneys and your bicarbonate. So we got to focus on the bicarb. So our pH is out of range. Again, it's not in range. So full compensation is out of the question. We have to decide if bicarb is in range or out of range. In range is uncompensated. Bicarb is definitely not in range because normal bicarb is 22 to 28. So again, pH is out of range. And bicarb in this case is also out of range. So we have respiratory alkalosis, partial compensation. Again, so again, once you guys follow these guidelines, it'll become super easy to get every single one of these right. Granted, it can still be a little confusing sometimes, especially if we don't do it correctly, obviously. If we don't pay attention to some minute details, like anything, we can get it wrong. So it's always really important to pay attention. So pH, 7.49. That's definitely elevated. We already know we're in alkalosis. Bicarb is also elevated. Guys, so we have metabolic alkalosis. Okay, metabolic alkalosis. What's going to compensate for metabolic issues? Your CO2. Is your pH in range? No, full compensation is out. So metabolic acidosis, CO2, is it out of range? I'm sorry, is it in range? It's definitely in range for sure because normal CO2 is 35 to 45. So we have metabolic alkalosis uncompensated. All right, pH 7.31. That's definitely low. Bicarb 25. This one can be tricky. I used to get confused with this in nursing school. Bicarb is technically in range, guys. It means it's not going to be either lower or higher. Because it's in range, technically it's going to be a respiratory issue, guys. Because bicarb is technically not trending down with the pH. Remember, metabolic issues, they have to be going in the same direction. In this case, bicarb is not going in the same direction because it's in range. So this is a respiratory by default. So this is respiratory acidosis. What compensates for respiratory issue, guys? Your bicarb. pH is definitely not in range. Has to be one of these two. Let's look at the bicarb. Is it in range? Definitely. So we have respiratory acidosis uncompensated, or uncompensated respiratory acidosis. Same thing. Alrighty, pH is in range, but it's definitely alkalosis, right? Because alkalosis is 7.4 to 7.45. So we have alkalosis. Bicarb, normal bicarb is 22 to 28. Same direction with the high pH. We know this is metabolic alkalosis. And again, we're going to look at the CO2 because again, your lungs compensate for metabolic issues, right? Metabolic alkalosis, but again, guys, look, pH is in range. So we already know it's full compensation. CO2 is definitely elevated. Metabolic alkalosis, fully compensated. And if you think about it, it makes sense, right? CO2 is out of range. And why is it out of range? Guys, we have metabolic alkalosis. Your pH is too high. So your body, you start hypoventilating or slowing down. You're blowing off less CO2, which means your body is trying to become a little more acidic to get into the normal baseline of 7.35 to 7.45. I hope that makes sense. So again, because we're in metabolic alkalosis, it means your body is retaining way too much bicarbonate. Your pH is going high. So what do your lungs do? What does the CO2 do? You start breathing less CO2 out to try to hold on to more CO2 so your body can come back down into range. That's what your body does for compensation. I hope that makes sense. It should make sense. If not, drop down questions in the comment section below, and I'll try my best to answer them. pH is 7.36. That's definitely on the lower end. Bicarbonate is elevated. Guys, different directions. Respiratory. With a low pH, respiratory acidosis. So we have respiratory acidosis. And excuse my writing, I know it's not the neatest. Respiratory acidosis. What do we look at when we have respiratory issues? Your bicarbonate. Respiratory acidosis. Well, pH is already in range, and your bicarb is out of range. So we have respiratory acidosis, fully compensated. So I hope that makes sense, guys. Review this, make sure you memorize this, and then from there it should become really a lot easier to figure out these problems. So again, fundamental differences. Metabolic issues, pH and bicarb go in the same direction, either high or low. Respiratory, your pH is high, bicarb is low, or vice versa. Bicarb is high, pH is low. So I hope that makes sense, guys. If you guys have questions, leave them down in the comments below, and I will see you guys in the next video.